Taking a pregnancy test can be an emotional and nerve-wracking experience. Whether you're hoping for a positive or a negative, it's important to use the test correctly to avoid misleading results. Let's talk about the 5 biggest pregnancy test mistakes people make when taking a home pregnancy test and how to avoid them. Welcome back to the Femhealth channel, a medical education channel by Doctors for You. Mistake number 1 of 5 is not waiting long enough to read the result. It's easy to get impatient when you're anxious to know the answer, but reading the test too early is one of the most common errors. Most pregnancy tests need at least 3 to 5 minutes for the result to fully develop. If you check before the instructed time, the result may appear negative even if you are pregnant. Always follow the specific timing instructions on the package. Now, let's get to mistake number 2. This is waiting too long to read the test and mistaking an evaporation line for a positive. If you leave the pregnancy test out too long, you can get wrong results. After the recommended reading time frame is over, which is usually around 10 minutes, an evaporation line may appear. This line is colorless or gray and can be mistaken for a faint positive result. To avoid this confusion, set a timer and check your result only within the window the test recommends. Mistake number 3 is not testing first thing in the morning. When you are taking a home pregnancy test, you should use your first urine of the day. Morning urine tends to be more concentrated with the pregnancy hormone. Testing later in the day, when urine is more diluted, increases the chance of a false negative. If you need to do the test later in the day, try not to drink too much liquid before you do it. Mistake number 4 is using an expired test. Pregnancy tests contain chemicals that detect HCG, and those chemicals can degrade over time. Using an expired test may lead to incorrect or unclear results. Before you test, you should always check the expiration date on the box. If it is expired, you should use a new one instead to make sure the results are reliable. Mistake number 5 is testing too early before your missed period. Some tests say that they can detect a pregnancy several days before your missed period, but not all people produce detectable levels of HCG that early. Testing too soon can lead to a false negative result. This means the test is negative, but you are just very early in your pregnancy, so it can't pick up the hormone. It is best to wait until you missed your period or a few days after for the most accurate result. By avoiding these 5 common mistakes, you'll give yourself the best chance of getting a clear and accurate answer.